Good day, everyone. So we will be tackling lessons 21 to 25 for our NOR 027. So lesson 21 will be tackling about sampling design. So, by definition, when we talk about sampling design is a method used to collect a sample from a larger population for your study. So, this is more into your data gathering. Before you're going to go to your respective population or the choice or your respondents, you really have to identify how many participants or respondents you're going to get in your study, the importance of which ensures that the selected sample is representative, leading to accurate and reliable research results. Not too much and not too low. Just just enough for you to identify with a total population which is too many and which is get a particular sample on that part, no? And not just too low, which is below 70 respondents, no, which could not generate a good data when being treated to statistics. So our goal is to understand how to calculate sample size using your Slovin's formula. So later on, I'll be presenting the Slovin's formula, so how you're going to apply it in terms of your sample size. So for the population, this is the entire group that the research is concerned with. So when we talk about second year nursing students, all second year nursing students are included as part of the respondents of your study. Say, for example, third year, fourth year, first year, and so on, or to all patients who are admitted right now in the hospital. Okay. So that's your population. And when you talk about the sample, it's just a subset of the population selected for the study, just a portion of which, unless if the total population is too low, then therefore we can go with complete enumeration. But if too many, say for example, more than thousands, 2,000, or more than 5,000, so we can consider a particular sample which being solved in Sloven's formula. So what is its purpose? Sampling allows researchers to make conclusions about the population without studying everyone. Okay. Yes, there's also a disadvantage and advantage if there are too many sample that you're able to get, no? Or going beyond what is really expected. Somehow the data is being generated might be biased if it's too high and if it's too low. So that is why it should be in moderate. So we have different types of sampling technique. I believe that you've heard random sampling, no? So every individual has an equal chance of being selected. So you're going to distribute your questionnaire to the nursing students, and everyone has a chance to answer your questions or be part of your study. When you talk about stratified sampling, population is divided into some group, and each samples are taken from each. Okay, so from the second year nursing students, we're going to divide it into two. Those who were able to pass and those who failed the particular study. And those who are able to pass, we're going to get again a particular sample of which. And then again, for those who failed, we also have to consider as well a certain portion of getting out of which. No? Convenience sampling, these are samples are taken based on ease of access. So the word convenience. No, it's really convenient on your part. You're just going to take a particular sample based on that specific population. So, say for example, with a second year nursing student, then you're going to get on that because that is being considered as part of your respondent. So, whichever you want, whichever student you want, whether the one who has a good academic standing or those who have poor academic standing, everyone can somehow get the chance to answer your questions or survey. Purposive sampling. Samples are selected based on specific criteria or purpose. So, for example, purposive sampling is very important with qualitative study because if you're going to study the lived experience of an individual, you're going to select as to who are really the population that you would like to get in terms of your sample. So, say, for example, the lived experience of second year nursing students who are having an HK scholar. So how are we going to deal on that? No, so particularly you are going to select a a respondent who would somehow fit, who has an HK scholar or who has a scholarship program right now with FINMA based on the explorative study that you're going to consider. Next is sampling design and its importance in nursing research. So its significance, sampling designs impact the accuracy of research findings. So we happen to know that if you are going to get a high number of population based on your study, it would really generate a good data. The saturation of the data on that, if you're going to treat it with statistic, is really enough for it to conclude or to have a good result. And what is its application to nursing? And nursing research often involves selecting a sample of patient, nurses, and healthcare setting to study interventions or even such a phenomena. So more into the clinical perspective, because research can somehow be done into the medical field, nor into the clinical field. So usually it involves with a patient as our sample, as our population, and part of which are the samples that you're going to take into consideration, and also healthcare workers who is part in the hospital setting. So this is a very good example of your Sloven's formula, which n represents the sample size, the bigger n represents the population size, and the letter E is a margin of error. So that range from 1 to 1 to 10%. So 0, 0.01, 0.01 to zero point 0.1. Okay, so that's basically the margin of error. And talk about the margin of error, that's basically a particular error which has a probability of creating an error into your study, no? So the lower the number, the better or reliable it is, no? So usually we control it with 0.05 lang siya in terms of the margin of error, which meets halfway between the lowest and the highest. But if you're going to consider 1%, it's more of a perfect, no? So usually sometimes it can be considered as a bias. So basically we're going to meet halfway, which is 0.05, which is somehow can be acceptable. Although I'm not saying that 10% is not acceptable, but it can be considered for as long as it won't go beyond. So let's understand the margin of error. So when you talk about margin of error, it's a level of accuracy desired in the study. So the higher the margin of error, the less accurate it is. And when you talk about 10% margin of error, that means to say that there is only a confidence level of 90% because you're already deducting it with 10%. Considering 5% as your margin of error, the confidence interval of which is 95%. And of course, with 1%, of course, it's more into 99% confidence, which is really somehow really reliable because it's more into a perfect number. So what are the steps? Let's try to identify first the population size. So say for example, in the nursing students who are enrolled in fourth year. So how many nursing students are there? So let's say for example, there are only 300 nursing students, 300 plus, no, or 324. Okay. On that particular population, select the desired margin of error. So which one do you prefer? As mentioned earlier in a previous slide, 0.05 would be preferable. And that's already okay, no, in terms of the margin of error. It's meeting halfway. Then plug the values into the Sloven's formula to calculate the sample size. Okay, so you're going to substitute the specific numbers into the sample size. So this is a very good example. So a population of 138, okay, for example, patients, no? The margin of error is 5%. Okay, so in Sloven's formula, the population, which is considered as letter N, is 138 divided by 1, which is constant, plus inside the parenthesis is 138 times the margin of error squared, which is equivalent to 138 divided by 1.345. Okay, which gives you a total number of final sample size of 103 participants. So it's very easy. Then you just have to substitute it. So, example in nursing, the use of Sloven formula is to determine how many patients to include in the study on a patient satisfaction in a hospital. So, say for example, in a hospital, there are so many patients that are being admitted and so many patients are being discharged. Let's say a 500 bed capacity hospital. Then all of the patients, no, who are able to discharge are given the chance to answer the survey, a satisfactory survey. And with the use of Sullivan's formula, you're going to determine how many patients are given or taken from the sample out of the 500 patients who were admitted. Okay. But there come a time that most of the hospital, in the hospital setting, all of the patients who are discharged are given the satisfactory survey. That if they're okay to participate with the survey. Okay, so we are not going to force them if they're going to participate or not. That's what we call total complete enumeration. When you talk about complete enumeration, you are going to get the entire sample, I mean population. You're going to cover the entire population of your survey. It's a bit tedious, but remember, it will somehow generate a a a good outcome of your study because you will be able to get the retrieval rate is higher compared to reducing it using in your slope formulas, getting a sampled approach, no? So the importance here is that we ensure that the sample size is sufficient to draw a valid conclusion without being unnecessarily large. Okay. So in that way, the conclusion would somehow be a good result or somehow be relevant to the study. It's because we are drawing a certain sample size only with the use of the Slovene formula. Okay. So to conclude, Slovin's formula is a valuable tool for calculating sample size. This ensures that nursing research is based on a representative sample. And of course, the takeaway is more the proper sampling design and sample size calculation lead to more accurate and reliable research findings. So let's go now to sampling design. Lesson number 22. So by definition, we talk about probability sampling, which involves randomly selecting subject from a population. So each unit has a known or non-zero chance of being chosen. So when you say probability sampling, we are probable. There is probability, no? In terms of how probable are we in terms of selecting the sample. So, say for example, in a population, then again, no, in a population of the second year students, you're going to consider it with the Sullivan's formula, and the number of the number of sample that is being taken has a chance of answering or being chosen to participate in the study. So we don't even know who are going to participate without applying yet your inclusion and exclusion criteria. Because if you're going to apply your inclusion and exclusion criteria, this would somehow decrease again the the sample size of what you are able to come up with your Sloven's formula. So there is really a big chance. Okay. So what's the importance of which? This ensures that a sample is representative of the population, reducing bias and allowing for more generalizable results in the nursing research. Of course, we have to consider avoiding biases because if there is bias in your research, it would really show up in your statistics. And we can see that one during the computation of the numbers of your stat, and it will even show us, no, a poor conclusion or recommend or probably having certain limitations of the study that are being considered due to biases. So what are the characteristics? So we have random selection. So every element has an equal and known probability of being selected. So random. So you don't know who will be the one that you're going to give with your questionnaire for as long as you're able to um, identify the sample size. Then ensure that the sample reflect the characteristic of the population. So when you talk about the characteristics, more into the demographic profile, profiling. Does it fit with the demographic profile or characteristics of the population? No. Meaning to say, are they really your respondents as part of your targeted respondents based on answering your research? No, in terms of participating with your research. The application in nursing research has something to ensure that the study findings can be generalized to a larger population. Okay, so it's very important to avoid biases. It's very important to increase the number of population or sample that we are getting. Okay. The higher the population that you are looking into, and with the higher number of samples that we can generate into, the better. Because that is to reduce biases. Because if there's only few number of samples that are being able to participate with the study, the tendency is it will not generate really a very good data based on the results of the findings. Simple random sampling, each element in the population has an equal chance of being chosen. So this is just more into a lottery system. So it's more into a draw by lots. It can be random number tables. You're going to assign certain numbers in a particular table and try to draw out from them. Or even if you're going to use an application in the internet, more into the computer generated random numbers. Okay, so those who were able or those who were given with the numbers 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, out of the 10, if we're going to get or draw something out from the box or out in that application, once it will turn out to be one, then you will be the one to participate in the study. So a very good example is selecting a patient record from a hospital database at random for a study on patient outcome. Say, for example, you would like to study more into the outcome of the patient, meaning to say in terms of the management, medical, nursing management, You also have different medications given, labs that are being worked up from the patient. No, does it have a better outcome during the management? So, out of how many patients that are in the databases of the hospital's computerized system, then one of which is being selected as a simple random sampling. Stratified random, the population is divided into subgroup, into strata. So, say for example, second year nursing students divided into how many particular groups. So, say for example, one group has a scholarship, the other group has no scholarship. In terms of scholarship na po, you're going to divide it as to how many percentage are these students are getting, how many of them are in this particular sample size, no? And the random samples are taken from each group. Okay, so those who have HK scholars are part of the study. We're going to get two from this one. Those who have a presidential scholarship, that would be another two students who have a particular scholarship. Those who have private scholarship, probably we're going to take around three based on the Sloven's formula, no, until it's being distributed. So the purpose of which is that each group is well represented in the sample. Because there is really a big chance, because if you're going to do random sampling, you don't know who among you of the following scholars were able to be part, no, of the study. So, say for example, what if during the random sampling it turned out during the automation of the application, which is a particular number, is more into the HK scholars. So it's the HK scholars are the ones who are able to have a better conclusion. But what about the other? What about the rest of the scholarship that is being provided? No? So grouping a population by age, no gender, or nursing specialty, and then randomly selecting each group. So those who are at the age of 18 to 20, this is one group. Then again, 21 to 24, 25 to 27. So it depends on how you're going to classify them. And among those particular those ages, who are these are female, who are these are male, no? So that if we're going to get a particular sample, it is really well distributed and everyone has a chance of doing so because they are being subdivided into groups. When you talk about cluster sampling, the population is divided into clusters. The random samples are selected from these clusters. So, say for example, cluster one, cluster two. So, among those students, no, who were able to enroll in a particular scholarship program, say for example with the HK, who among this particular cluster are good in academics or having good academic grades. How about those who have poor academic grades, which did not reach to 60%? No, so looking into the scholarship program, how effective it is in terms of work-life balance and also academic life balance of the nurse of these students, no, who have this kind of scholarship, we're going to look into consideration in terms of clustering them, so that we will be able to really come up with a particular population and they're really being trimmed down into certain cluster. So often used when sampling frame is not readily available. No, so it's really easy for us to classify and to identify as well. No, however, with this one, it takes so many research because you're going to provide certain transmittal letters in order for you to come up with a very good number. So you're going to ask permission from and the Office of Registrar, and also with the scholarship program from the student life. No, so that would also be a tedious work for you to do so. So selecting random in hospital in a region, then selecting random patients within those hospital for a nursing study. No, so Region 7 hospital, Region 8 hospital. So among those hospital being selected in Region 7, who can somehow um who can somehow participate in the study, particularly the private or government, infirmary, or on sa manisiyan, no? So we have to consider that. Systematic sampling. The selection of samples is systematic sequence. So every fifth person, we are going to rank the number of individuals. No, so among the nursing students who are enrolled right now in second year, we're going to select right now the fifth person in rank in alphabetical order, or probably it's more into it's somehow random, no? Whoever is in the number five, everyone has given a number, and those that you have selected, the fifth person that you have selected, or the number five that you have selected, will be the one to participate in the study. Okay? A random strat point is chosen, and every n element is selected. So it can be the fifth, the tenth, whoever got number 15. So for example, again, The person who got number 20, no? So they are the ones who can participate in the study. Same as in the hospital. So out of the 20 patients right now that are being discharged, if we're going to look into consideration the number of placement of patient, no, from the first person gonna discharge up until the last cut off around 6 o'clock in the evening or 5 o'clock in the afternoon, then we are going to consider selecting the nth element. Okay. So what is the formula? Where K is a sampling interval, N is again a population size, and small n is a sample size. No? So what is its application? It's more systematic sampling, helps us ensure that samples are evenly spaced across the population. So what are the advantages and disadvantages of probability sampling? So less bias in sample selection, no? Because we will not be able to identify who these individuals randomly. So meaning to say they're really well clustered, they're really been selected, no? And more generalizable results based on the conclusion and even the outcome of the study and even the results. Okay. The disadvantage is that it's really time consuming because there are certain procedures that you have to consider in terms of division, in terms of asking permission from this particular department of doing so, no? And can be difficult to implement, especially with a large population or without a sampling frame, meaning to say you are not being guided and you don't have any idea as to who are you going to classify based on the sampling frame. So what is its importance of probability sampling in nursing? So one of the relevance of which is it ensures that nursing research is based on data that accurately represents the population. So we can really determine, we can really identify, no, that that particular selection is really based on the population, no, and we're not getting it from one way or another compared to really with random sampling. Application is helps to create evidence-based nursing practice by ensuring that the research findings can be applied broadly across different settings. So it's not just in nursing that we can apply, we can also apply it in the clinical, in the academe, no? Very important. To conclude, probability sampling is crucial for ensuring valid, unbiased, and generalizable results in nursing research. And our takeaway is understanding the different types of probability sampling enables researchers to choose the best method for their study, ensuring accurate and representative findings. So let's go now to lesson 23, which is your non-probability sampling. By definition, non-probability sampling involves selecting respondents in a non-random manner. So it's more systematic. No, so we're not doing it randomly. Not everyone is given a chance, okay, to be part of the study. Commonly used in nursing research when generalization is not the primary goal, but rather in the in-depth understanding. So, for example, in a case study analysis, in which you're going to identify only one patient, which is a very good disease condition, no? Or probably with so many diagnoses being identified from the medical practitioners, no? So thus, it's an interesting case, and we are considering that patient as part of the study. So, what are the characteristics? Subjects are selected based on availability or specific criteria. So, say, for example, in the number of nursing students, from the first year nursing students, second year, third year, and fourth year, those who are able to get an average of almost 90% and above has a chance to be part in offering the presidential scholarship, no, or a certain scholarship on their next academic journey. Okay, so more into the selection, no, of a specific criteria. So not everyone has a chance of doing so. So use when random sampling is not feasible. Okay, so application often used in exploratory or qualitative nursing research. Okay, so in qualitative mode, you're going to find somebody who is really perfect with certain lived experiences. If, for example, in a epidemiological study, no, you're going to select somebody who is really perfect with her lived experience. As a second year nursing student who is now in FINMA, who is enrolled with a particular subject in maternal and child nursing, no? So not everyone is being enrolled. Not all second year students are enrolled with maternal and child nursing. Some of the students are being considered as regular and irregular. No, some of them already passed. Some of them doesn't have any resources or not no enough financial, no, capability of enrolling that subject, though her studying is second year. Okay. So accidental or convenient sampling. So selecting the most readily available participant in terms of volunteer samples. So you're going to give a questionnaire. Whoever is available, they can answer the questionnaire or be part of your study. Often used when it's difficult to gather a random sample. Because with random sample, there might be exclusions of the criteria. They don't want to participate in your study. That can be a very that's one of the worst exclusion criteria that we can also consider, but be part of the discussion of your study, no? A very good example of which as well is serving patient in a clinic as they come for appointment. And once they have their appointment, they're really willing to participate in the study. They're really available. They're available because they came to the clinic and at the same time they're willing to participate in the study. So that can be convenient sampling. Quota sampling. The population is divided into strata and the quota is filled from each stratum. No? So, i-clusterin mo siya sa iyang strata and there is this quota which is being filled and part of that division, nganhanin mo siya kung anong total na number of respondents who will be participating. So ensures certain groups are well represented. Okay. A study involving 40% male and 60% female nurses, no, based on gender distribution in the hospital. Okay. So we have a quota that 40% are male. Those 40%, as part of the division of its demographic profile, are also been given a chance to participate in the study. Nonetheless, those 60 are not allowed to participate. It's because they already been excluded with the criterion. Purposive or judgment sampling, no? So these subjects are handpicked based on specific qualities or characteristic relevant to the study. So if that particular person or the demographic profile of the patient has specific quality or even characteristic relevant to your study, no, especially identified in your demographic data, then that patient, that particular respondent can can somehow participate in your study. Typically used in quali research where the goal is to obtain detailed information. Our purpose to get that kind of individual in a quali study is to make sure that we can extract those lived experience that they experience. Because if we're going to identify somebody who is not able to live on that kind of experience for your phenomenological study, then it would somehow generate a poor data or doesn't really answer the research objective questions or goals. So selecting nurses with at least 10 years of experience for study on leadership in nursing, no? Because not all has an experience of 10 years after they become an RN. So very important. We have considered that the number of experience, no, in terms of the qualification of answering the study. So we also have snowballing networks or network sampling. So when you talk about snowball, initial subjects refer other qualified individuals to the researchers. So say for example, I'm a second year nursing student and you're not really familiar as to who these second year students are because you couldn't see them during their class, nor you're really new into the field. Then the one that you are able to identify would somehow refer this one here, I do have my classmates in there. You can somehow also gather data from them. Probably you might also I'm going to consider them in answering your research. Okay, so the referral system is there. So used to hard to reach populations or when a sampling frame is unavailable, especially that the schedules are not really the same, no? And it's really hard for you to identify them because some of them are on duty, so they're in different hospitals, no? And some can really recommend as to where these individuals are. So she can recommend if the other sections are in the other building or in the other room. Probably you would like to try gathering data from them. They're also second year nursing students. Okay. A very good example of which is interviewing a few nurses working in rural areas who then refer others for a study of a rural healthcare. Okay, so the nurse is referring a different rural nurse from other hospital. So she can say that you go to that particular hospital, there are 10 nurses who can somehow possibly um, participate with your study, you know, so you have to consider on that. Consecutive sampling has something to do with the recruiting all available subjects who meet the eligible criteria, particularly the inclusion criteria over a specific time or sample size. And say, for example, no, part of the inclusion are those who are currently employed in the hospital. And the number of hospital years of service is not being considered. Anyone can somehow join. So those who are employed in the hospital has a chance and being considered. No? Its usage has something to do with the consideration of the best non-probability sampling method as it includes all eligible subjects can or qualified with the subject. I mean participants of the research subject. Enrolling every patient admitted to a ward for 2 months in a study on post-operative care. No, so those who are able to have their admissions at the ward for almost 2 months, only few of them are able to experience that. No, due to increased number of hospital stay or prolonged hospital stay. Okay, so they can be part of the study. So for those who did not reach it 2 months, it's easier for you to identify your sample because you're already excluded. Theoretical sampling using qualitative research to develop theories through data collection and analysis. No? So usually if you're going to do generation of theory or theory generation as part of your quality research, which is kind of difficult for you to do, no, that it's really a tedious type of qualitative type of research. It would really take you mostly years to finish on that. No? You're going to identify certain individual that can somehow prove your theories or help you generate some theories, no? Its usage focuses on a gainer deeper understanding and discovering a relationship between two concepts, okay? Particularly with two different variables in the study that are being studied as well, okay? So example, studying mothers of twins to explore their unique parenting challenges, no? Considering certain theories are already applied for maternal bonding. But right now, how about these mothers who have twins? How can we come up with a very good theory or assumption and model on this, particularly with their unique way of parenting, especially that they are caring for two children at the same time? So, what are the advantages and disadvantages? One of the advantages is that it's really convenient and less time consuming. Why? Because you can already identify the certain population or even the sample based on the categorization. No, it's less expensive compared to probability sampling because it would not take you some time and some other resources to identify your sample size. However, there is really a disadvantage to which is a higher potential for biases because you're going to select it right in your end. And what if, no, based on the one that you're selecting, um, we can already conclude certain generalizations. No, it's because they've already been clustered. Okay. So there might be some generalizations that can be generated already with some of the assumptions based on the population that is being taken. And limited generalizability to broader population. Yes, that is correct. No. So the more that it's that you're able to identify in this particular cluster only, the broader that it would somehow generate certain information or data generalizing the entire population because of the certain cluster that is being identified, no? So to summarize, non-probability sampling method provide flexibility and are useful when the goal is to gain deep qualitative insights. And each type of non-probability sampling has its strength and limitation, understanding when to use each, which is really essential for effective nursing research. Let's talk about research instrument, which is lesson number 24. So when you talk about research instrument, it has something to do with the tool, the questionnaire, the survey paper that is being used to collect data in your study. So an instrument pertains to the checklist, to the Likert scale that is on paper. No? They ensure accurate measurement of variables and consistent data collection in nursing research. Might might be quali or quantity or mixed method research. No, you're going to consider an instrument on that. Okay. But usually right now, since our group is more into a quantitative research, a questionnaire is being considered as your standardized tool for researcher made instrument. So instrument includes questionnaire test scales and interview guides, as mentioned earlier. Interview guides for qualitative study, scales for quantity, tests for quantity, questionnaires can be mixed method for quantity and quality. So its purpose to gather data relevant to the study objectives and are designed to be reliable and valid. As mentioned, it's very important that we have a standardized questionnaire because we can already identify what particular studies were able to utilize a certain questionnaire in the past. Okay, so you just have to identify certain studies that are being discussed. In terms of validity, content, phase, no, underwent factor analysis that can be considered as part of the validity, wherein certain experts and individual already critique on which and provided insights already in the instrument that is being done. Okay. And of course, the cronback alpha is very important as to how reliable it is in terms of its validity. Okay. We also have researcher made because if it's a researcher made, we need to do content analysis, space validity analysis, and at the same time, we're going to do pilot testing. We're going to run it, no? Selecting 10 individuals to answer your questionnaire, and if done, you're going to tally it. Once tallied, a statistician will going to run it in the SPSS, no? And generating data. The the higher the number of the Cronbach alpha, which is considering one is the highest, no, has a better reliability scoring. So say for example, it's accepted if it is 0.7 up until 1, which is the highest. Okay. Lesser than that, probably it's not really that reliable or somehow it will depict that it is out of the context or doesn't really answer the objective questions. So definition is a structured set of questions for participant to answer, often in written form. No? So you are going to print that one in a bond paper. You can also print it in a newsprint. So that's cheaper compared to printing it with your bond paper. No? And it can be done back to back. Remember guys that in printing your questionnaire, it's not really necessary that you're going to do it in double spacing or a font size of 12. It's very important that we are going to lead those who will be answering the questionnaire, particularly that they'll not be confused. So one part of the questionnaire can somehow suffice one page of the questionnaire. And the second part can be at the back or in the next page. Okay. It's one way of making sure that the one who will be answering the questionnaire will not flip the tool again and again. Because if they can somehow do if you're going to present it that way, tendency is they might decrease the interest of answering the questionnaire due to confusion. Questionnaires are also commonly used to measure information level, options, beliefs, and demographic data. Usually, demographic data is being found in part one. Your opinions, beliefs, and information levels can be part in the measuring Likert scale. No, on a scale of 4, 2, 3, 1. No? Which of these particular scale would somehow perfectly fit your decision in terms of the item 1, 2, 3, 4, 5? No? So therefore, a questionnaire, particularly in a quantitative study, there is this Likert scale that is being presented. So free response, no open-ended question. Respondents are provided answers in their own words, offering detailed insights. So what are your thoughts? What are your insights? So that is more into an open-ended question. Somehow an open-ended question can be utilized in quality. And even an open-ended question can also be utilized in quantity just to verify and justify those items that needs to be justified and needs to be explained. Okay. But if it's quantifiable, no need for you to ask certain questions. Remember, the more that you ask number of questions, the higher you're going to interpret another certain topic of the study. So there is an advantage and disadvantage. No, so if you talk about the advantage, it's more rich in terms of detailed data because you will be able to get data coming from the respondent, which is being answered with the question how. Okay. And for disadvantage, it's really time consuming because you're going to ask questions, probing questions before the real questions that you're going to throw, and also the closing remarks. It would really take time. Plus, as well, answering quantitative questionnaires Okay, which would also take time because you really have to wait for the respondent to answer everything. Okay, if they have questions, you are there to answer. You're going to present yourself to them. And it's really difficult to summarize because you're going to identify certain themes, no? Or what is really the importance or the big idea of what he or she is really doing, and I mean answering based on your question. You also have close-ended question. It's really necessary for us to consider that. Okay. So respondents choose from predefined answers provided by the researcher. And of course, it's easier to tabulate and analyze. So sometimes an open-ended question is answerable by yes or no. Okay, it's more into like survey. But there come a time that you also have to consider that in terms of answering or how having your respondents answer those types of questions for verification purposes. Okay. However, there are also surveys that you're going to answer yes or no. Okay, which is for me, if it's really a survey, it's just easy for us to treat the data because it's just answered yes or no, no. And in terms of parametric scoring, we don't have really a parameter on that because it's just an open-ended question. However, it limits the depth of response to the given option because the respondent doesn't really have any choice to answer. No, either yes or no will somehow suffice with a close-ended type of question for a certain survey. Formulating effective research questions. So first, review study objectives as well as problems and sub-problems. Your research question can be found in your statement of the problem. Your statement of the problem has something to do with the plot, okay? You also, the problem, the location, the objective, and also the time as to when are you going to conduct it. And of course, the series and number of questions, no, that can be seen and can be answered in your questionnaire. So remember, as mentioned earlier, no, in our previous discussion, that it's very important for you to identify first a standardized questionnaire before you create a study, because it's easier for you to identify your research questions because you base your research question on the instrument and what you are doing. However, we also have the inductive type in which you identify certain questions, research questions, and that's the time that you're going to create your own instrument, which is somehow tedious because you're still going to do it in a pilot study. Then you have to create questions related to the research topic based on existing literature or logical assumption. You also have your um your null hypothesis, no, if there are significant relationships that you would like to identify, if there is a predictive study as well that you are going to consider, if there is a difference of the study as well, and that can be considered as part of your problem. Then adapt questions to target population's knowledge and language level. So this is the time that you're going to create a questionnaire. Provide certain questions that will somehow answer with your statement of the problem. Okay, but if you're going to have a deductive type, identify an instrument, standardized instrument, look for its reliability and validity, then you're going to identify certain research question based on it. So avoid ambiguous, no, or ambiguity. Ensure that the questions are really clear and have one interpretation. Because usually, if there are some questions, no, it might be considered as a general question and it's not already answering a particular variable of your study as to why you really wanted to have that kind of study. Avoid double barrel questions. So don't ask multiple things in one question. Very good example is the course challenging or interesting? No, kada siya. By the way, these questions can be translated in your items, in your instrument or questionnaire. If there is a question, no, in your items, no, that is being considered, no, as the questions being formulated or really the questions of a standardized instrument. Okay, so this one in this particular slide, we're talking about research made question. Okay. Avoid negating words. Negative words can confuse your respondents. So, do you not agree? No, so it would somehow lead to confusion. No, so What what do you think? No, would be the reaction of your respondents to that? No? They might comment that the question is somehow confusing on their part. Okay, so you will not be able to come up with a better answer. Advantages of using questionnaire, it's easier to administer than interviews. Okay. So you can distribute it through Google Form, which is an online platform. Another thing is your pen and paper, which you print it no, in a newsprint or a bond paper. Okay. It's easier for you to do that. Anonymity. Okay. It can preserve the confidentiality of the participants. Okay. It's very important to make sure that the confidentiality of your participant is there. It's really part of your ethical consideration. That's part of the discussion of your ethical consideration, no? In your book. That's in the last part. And cost effective, which is relatively inexpensive compared to other data collection methods. Because a pen and paper would somehow suffice, or probably with a G form, no, that they're just going to answer it directly for as long as they have an internet connection. We also have disadvantages in terms of response rate, may have a low rate response, no leading to biased results. So there come a time that they don't want to answer your questions or you are not there at their side. If they have questions, then they're not going to participate anymore because of certain reasons, no? Or probably they're not being monitored anymore. Limited ability to clarify questions or responses if confusion arises, no? So you just try to distribute it and you're going to leave them, right? So to avoid those things, no, you have to be at their side once they do try to answer it so that you can answer their questions. And respondents must be literate and able to understand the questions because if they don't understand it so, of course, they can be part of the exclusion criteria or they cannot participate with the study perhaps. To summarize, research instruments, particularly questionnaire, play a crucial role in data collection for nursing research and developing well-structured and relevant questions ensure the collection of accurate and reliable data leading to meaningful research results. Lesson number 25, other types of research instruments. So this is just a continuation. So by definition, it's also tools or devices used to collect data for research purposes. Okay. So ensures that data collection is well consistent, valid, and reliable, especially in nursing research. So we have to make sure that whatever questionnaires that you are making, it should be validated. Then again, no, some other nursing students are not able to have their instruments validated during the research nursing research one. Supposedly, before you're going to have your proposal, if you're making your instrument or your own instrument, it goes a long way because you're going to do validity testing. And with validity testing, it's very important, no, that you are going to do pilot testing if it's a researcher made, no? So that would really take you some time if you're going to make it in your own. So probably a very good suggestion in that. Find a standardized questionnaire, perhaps. Definition is a dialogue between researcher and participant to gather detailed responses, no? It's very important that with interview research instrument, it should be recorded using audio video devices or notes taken by the researcher because not all the time that you can somehow observe and identify what the respondent is really doing. No, you also have to consider the nonverbal cues as part of the data that you have extracted from them. You have structured interviews. So these interview questions are pre-prepared. No, so when you talk about structured interview, that's a preconditioning during and also the post conditioning no and up until you end the interview. Unstructured interview is more into flexible questions that flow naturally. However, suggest that you go with a structured interview for you to be guided, okay, so that once you're going to throw the questions, it can somehow ready you to the next question and can somehow pace you during the interview portion. Personal interview, it's more into face-to-face basis. You interact. The respondent is in front of you while you're going to interview them. Phone interview or cell phone interview conducted over the phone, offering convenience, especially during the times of COVID pandemic, no? That during qualitative research, we highly utilize telephone interview or even through online platforms such as your Zoom and even your Google and Microsoft. Mail survey, participants complete the survey at their leisure. So we can do so, know that they're just going to narrate it based on their answers. However, we are not able to identify anymore the gestures, what the participants are doing when they try to answer the questions. No, so that can somehow lead to poor data collection. Web page and email survey, the same as mail survey, which is online questionnaires that allow participants to respond at their convenience. No, or probably you email them in whichever particular time at their convenient. In having the interview, then we have to consider that. Next are the advantages. So broad and varied responses, verbal and nonverbal behaviors can also be observed, right? If it's more into the face-to-face interview. And of course, not all participants have the same answers. That's really the best good thing about um, qualitative research because you're identifying number of participants who are eligible, particularly probability sampling, that you can generate a very good data or response. Also, you have your disadvantages. When you talk about disadvantages, it's time consuming and expensive, no? Because you're going to have your own setup, you're going to have some time that you're going to consider for the respondents as well as with yourself, no? Should meet together, no? Responses may be influenced by the interviewer's behavior. So there come a time, no, that the one that you're going to interview is not cooperating or probably rolling his or her eyes during interview and doesn't pay attention on what you are asking or what you are doing. No, scales as research instruments. So these devices that assign numeric scores to measure attributes such as your attitude, perception, and experience. This particular questionnaire has something to do with your Likert scale. What is the Likert scale? Looking into your questionnaire, if it's quantity, it's usually more into three, four, five, six, no? um columns that is being divided, no? Usually there are four Likert scales that measures agreement and disagreement. A very good example of which is you have the strongly agree, agree, disagree, and strongly disagree. So agreement type of Likert scale, pwede po na siya, no? Usually if there are four Likert scale, it decreases the number of bias because there is no middle Likert scale that your respondents can choose. However, if there are only three, tendency is, say, for example, sure, unsure, not sure. So most of them are doing the unsure, no? So it would somehow give you hard time in terms of giving generalizations, okay? And also conclusions and the discussion of results, no, might be considered as bias. You also have your differential scale, semantic differential scale, rates concept on bipolar scale. No? So this is being used for those patients who has bipolar and those patients who have pain, which is your visual analog scale. No, measure subjective experiences such as pain felt by your patient. No, usually this is being used in the hospital setting. We also have the graphic rating and the Q sort scales. The respondents rate the concept on the continuum of 1 to 10. So that's the graphic rating scale. A very good example or technique are the participant sort card with phrases or statement based on specific dimension. Okay, so from a scale of 1 to 10, no? Which one are you going to prefer? 1 lowest, 10 highest. And that's yeah. So more into the graphic one. Vignettes are short description or scenarios presented to participate to elicit responses on their perception, opinions, or knowledge. Where is it being used? Vignettes often used in research involving ethical dilemma, healthcare scenario, and patient experiences. So it's more into the opinion of the patient, that we are going to extract based on the knowledge as to the patient understanding. Okay, that's basically what you are looking for. Your self reports. Participants report to their own behavior, attitudes, and experience. So, based on personal experiences. So, we have the retrospective self report. When you talk about retrospective, it's in the past. We're looking into the past experiences. So, you try to ask your patient to recall certain events in the past, which can be inaccurate due to memory bias. This is just a disadvantage. advantage. Okay. Looking at the past, sir, what have you noticed in your end? No, are you trying to drink alcohol? How many times do you drink alcohol in a day? So the patient will somehow say, probably around one or two, perhaps. No, so these are just self-reports in which they have an estimate of what they're doing. Mechanical instruments and documentary materials. So this includes your diagnostic machines and radiologic procedure results. This includes your X-ray, your MRI. You also have your medical devices and other technologies used to gather physiological data. It's very important to correlate the medical intervention based on mechanical instruments because this is one way of treating our patient. For documentary materials, this includes anecdotal records and documents that provide supplemental data to primary research. Okay? Usually, medical records with that kind of record being issued from the patient's admission. That can be a documentary material which has a document to provide supplemental data for primary research. To conclude, there are various types of research instruments beyond questionnaires, such as your interview skills and mechanical devices. And also choosing the appropriate research to instrument is really essential for accurate data collection in nursing research. So if you have any questions, you can key in the comment section below, or you can ask questions in our GC. Thank you for listening and have a great day.